World Sight Week is an annual event dedicated to raising awareness about blindness and vision impairment. This year's theme, Love Your Eyes, encourages everyone to prioritize their eye health. In Nigeria, where eye care is often overlooked, this message is particularly crucial. Eye care and Nigerians' attitude towards eye care would be the bane of our conversation today. I'm your host, Aisha Salihu. Thank you so much for joining us on the program. And now joining us today to talk about it, we have Dr. Mmaduagwu, who is an optometrist. Before we get to our guest, in Nigeria, the general perception toward eye care is one of neglect unless there is an obvious issue, such as poor vision or significant discomfort. Routine eye checkups are rare, and many people still rely on home remedies or over-the-counter medications to address eye problems. Now, according to recent data from the International Agency for the Prevention of Blindness, about 24 million Nigerians are living with vision loss and 1.3 million are blind. Additionally, around 50 million Nigerians have non-vision impaired eye conditions that require basic eye care services. These numbers highlight the urgent need for improved eye care services and awareness. Doctor, now let me have you on the program.
Hi.
Let me start with what would you say are the most common eye problems one encounters in Nigeria?
The most common will be refractive errors. So you have myopia, hyperopia, astigmatism. So this is a condition whereby you need glasses, one, to improve your vision. But a lot of people neglect it because they feel like that is their normal vision. But it's only when you come to the eye clinic you know normal vision from abnormal vision. So yes, please.
So apart from that particular one, what else I just want us to establish the major eye issues we have. You have talked about this one that is neglected. What other?
You have cataract, you have glaucoma, then you also have age-related age-related macular degeneration. These are the most common eye diseases in Nigeria.
And they are often neglected.
Yes, please.
So I'd like to hear from you. How often do you think individuals should get their eyes checked?
So it's advisable to at least check your eyes. If you're above 40, at least check your eyes at least once in 2 years. And if you're younger, at least once in 2 years is also advisable. But it's also important that if you're diabetic or hypertensive, it's advisable to check at least once a year.
At least once a year. So you're saying at this moment that once you check your eyes at least once a year, especially if you're diabetic, or once in 3 years, some of these common eye conditions would be detected early enough, right?
Yes, please. So when you visit the eye clinic, it's important that a comprehensive eye check will be carried out, where your intraocular pressure is checked, how you see, that's the visual acuity, and also check or assess the back of the eye, the retina, which is keen for you to see me today.
Now, amongst the most common eye conditions you stated earlier, and also the very serious ones, which is glaucoma and cataract, I'd like to hear from you. What would you consider as the early signs of these serious eye conditions? Let's start with glaucoma.
Okay, glaucoma is termed the silent sight stealer for a reason. It has no sign or symptom. But the earliest sign the patient will notice is when the patient has already lost a bit of their vision. You have tunnel vision, and this is really dicey because any vision lost due to glaucoma cannot be regained. So it's important for you to come to the eye clinic to have your eyes checked. Then for cataract, these signs include cloudy vision, because cataract is when the eye already has an intraocular lens. So due to age, which is the most common risk factor, the eye lenses change and become opacified. So you have the patient presenting with cloudy vision, distorted vision, light, seeing colors and flashes. These are the early signs and symptoms the patient will present if the patient has cataract. Thank you.
Now let us go back to glaucoma. I know you did term it as a silent thief of sight,
yes,
meaning
please.
You may not really know that you are presenting with this particular eye condition. I'd like to know what other risk factors would you say there are for glaucoma, and then also let us look at cataract, side by side.
So for glaucoma, you have the patient presenting. When the patient comes in, they have above normal eye pressure. So when your pressures are higher, so let's take the eye as a ball, okay? what keeps the eye in shape is the eye pressure. So at the back of the eye is what they call retina. So when the pressures of the eyes are high, they damage the nerves that connect to the brain, which make you to see. So the ideal pressure is between 10 to 21, but most patients that are glaucoma, they have higher pressure. And when the pressures are higher, they damage the back of the eyes. So this is one of the risk factors that causes glaucoma. But other things happen. There's also normal tension glaucoma, whereby the pressure is normal, but there are also associated damage to the back of the eye, which is the optic nerve. So it's only when you come to the eye clinic, we'll check your eye pressure and do some routine eye tests to know whether you have glaucoma or not.
For the other type or the other risk factor that you mentioned just now, I'd like to hear from you. I know we have stated, and even previous episodes before now, we have established that for glaucoma, it's almost like there is a family history, and the risk factors would be it comes in people who are of black origin and all of that. What else do you think could be responsible for the eye pressures to, the pressures to be, I don't know, how did you put it earlier?
Increased. So the other factors that have been shown study whereby the angle is closed. So you either have a closed angle glaucoma or an open angle glaucoma. But the most common is when it's open angle, because in closed angle glaucoma, it's usually sudden. You have red eyes and everything, and it leads to blind eyes. So, but the most common one is open angle, and whereby there is build up of pressure due to the angle that like there's a kind of pathway whereby the fluid in the eye passes out. So when the angle is closed, it kind of reduces the amount of fluid that passes out of the eye, which increases the buildup of eye pressure in the eyes.
Okay, now let us look at the impact of diabetes on eye health. Earlier you talked about how, especially for patients who are already diabetic, if they present with this eye condition, maybe if they check it within a year, the span of a year, it could be handled sooner rather than later. I'd like to hear from you. What is the impact of diabetes on eye health?
So diabetic patients have risk of having what they call diabetic retinopathy. In diabetic retinopathy, there is leakages, the vessels in the behind at the retina, they burst and they cause hemorrhage and also like swelling of the retina. But when your sugar levels are low, you have less risk of having diabetic retinopathy. It's always important that you should have, the lower your sugar levels, the better for diabetes not to affect your eyes. Also, diabetic also leads to cataract. So when your sugar levels are high, one of the major signs you know that your sugar levels are high is that you experience blurry vision. So when your sugar levels are high and you know you're diabetic and you have blurry vision, you know it's right time to go check with your medical doctor and keep your sugar in check.
But then it's not in all cases. I just want you to correct me here. Is it in all cases where one presents with a blurry vision that you'd say is as a result of the high level of sugar in the blood system or diabetes?
No, not at all. It's not in all cases, but most diabetic patients, when their sugars are high, I was specifically about diabetic patients, blurry vision is one of the skin signs of a lot of eye diseases. So if you have blurry vision, be it diabetic or not, your eye doctor is one of the first places you come and visit to make sure to know what causes it, the blurred vision. Okay.
I know we have established diabetes here. I'd like to hear from you. Are there any other medical conditions that could impact eye health?
Yes, there are. Hypertension. Studies have shown that hypertension can lead to high ocular pressure, which is related to glaucoma. Okay. So there is also HIV. The eye is very unique. Signs, we can pick up trauma, tumor, and other things. So it's always, that's why they say the eye is the window of the body. So through the eyes, we can see whether you have any heart conditions and high lipid layers, cholesterols and everything. So it's always important for you to visit your optometrist for a proper comprehensive eye examination.
Okay, now let us look at eye condition from the perspective of gene, right? And also getting it from maybe the parents, or I'm talking about offsprings now. How does that come about?
So studies have shown that if you have the tendencies that you are 2 to 4 times at risk of having any eye condition that your parents have. So if your parents are myopic, it's always advisable that they should take their kids to the eye clinic for checkup just to detect their myopia at the right time. So just like also glaucoma, she said family history is a risk factor for glaucoma. So if I have glaucoma or my parents have glaucoma, I should be aware that whenever I go to the eye clinic, I should ask questions. Is my eye pressure in check? Do I have any signs of ocular damage? Like, is my optic nerve perfect? Any signs? I should do like a 3D scan of my retina to make sure that I'm good, and also yearly eye check. So whenever you are at risk for any ocular eye pressure diseases, kindly visit the eye clinic for examination.
Just so we clear the air, I like to hear from you. You know, for some diseases, they will tell you, I mean, experts will tell you that it presents in certain population, certain age range, certain maybe gender and all of that. I'd like to hear from you. Are there some eye conditions that you'd say they're more prevalent in the younger children, and there are others that are more prevalent in adults? I just want to hear if there is that disparity.
Yes. So kids have the tendency to have frequent conjunctivitis, that's pink eye, because of they're always putting their hands in dirty places and their hand-to-eye contact is higher. So, but for adults, one thing that is keen for adults is that because we aging comes with a lot of eye changes, especially cataract, which I mentioned is due to age. You also have something called presbyopia. When you are 40, you see the tendency to use reading glasses to aid near reading because of your lenses reduce the ability to focus. So these are diseases that affect ages.
Now let us talk about the use of corrective lenses. Now, what would you say are some of the misconceptions about wearing glasses or contact lenses?
A lot of people, when they come to the eye clinic, I always have to clear this myth, which is really common, that my doctor said that if I wear my glasses, it's correct. If you wear your glasses, you will see me. But if you take them out, you're back to how your vision is. So this is something I always want to tell my patient when you come in. This is your vision. And I give you glasses, you can see me clearly. Take it out, this is how your vision is. So your glasses are just meant to improve your vision. So they're not going to permanently correct your vision. This is one thing. Then for contact lens wearers, I always advise my patients, if you stick to good hygiene, you wear your contact lenses well, because most times people feel like if you wear contact lenses, the tendency that you might get blind or something, or the contact lens is going behind your eyes is high. But with proper education and also hygiene, you're perfect with contact lenses.
Let me still take you up on that lenses that you talked about earlier. You did say it's for the purpose of correcting, not necessarily to repair, permanently. But then you hear some experts will tell you that this glasses, you're expected to use it for a certain period of time and then drop it. So what then happens afterwards?
It depends. I don't, when you say use it for the particular time, it depends on what the person is treating. But most times, when you're high myopic or you're astigmatic and is of high severity, the tendencies that you will drop the glasses are near to impossible, because you need to wear them to see. There's some people, when they wake up, the glasses are the first thing to wear. You can't tell that person to drop the glasses the next 2 to 6. It's just like if you're stressing the person, because that's what the person helps to the daily activities with that. So I would not know why the doctor would say that, but it depends on what the patient or the doctor is treating.
Okay, thank you so much, Doctor. That will go on a quick break now, and when we return, the conversation continues. Stay with us. Welcome back, and thanks for staying with us. We're still talking about, highlighting the importance of eye care. And we still have our doctor in the studio with us, Dr. Mmaduagwu. Thank you so much for staying with us on the program. Now, doctor, I'd like for you have addressed the issues of glasses and also wearing of contact lenses. I'd like to hear from you. Many Nigerians use unregulated eye drops and traditional remedies to self-treat eye conditions. What would you say are the potential dangers of these practices?
So in the clinical settings, I know a lot of people believe urine, first morning urine, breast milk, leaf, water, cure a lot of eye disease, which is very harmful. This is not authorized. They don't have any backing. They even lead to more danger. So I always advise people to avoid such practices and also just stick to the regular eye clinic. I've always been saying eye clinic, because eye clinic is your first stop for anything eye problem, because all this kind of harmful practices leads to blindness.
Thank you so much for that response. In your experience as an optometrist, of course, what would you say are the most common symptoms that Nigerians tend to ignore until they become severe? And how can public health campaigns be more effective in educating the population on the early warning signs of major eye conditions?
So one of the major signs and symptoms I know that a lot of people feel is normal is maybe intermittent blurriness. You feel like, because blurriness is kind of dicey. Your eyes an organ, so it has muscles, and it works in a way that you might have blurry vision right now, but if you focus on something longer or stretch your hand, you might regain focus after a while. So people might feel like, "Oh, maybe it's just it." So in case you have blurred vision, it's important that you should come around, especially when you're above 40. You see a lot of people feeling that, oh, I know I don't want to wear glasses or something. I know they're in denial, but with time, if you feel the blurred vision, it only gets worse, funny enough. So when it gets worse, the eye doctor is your first point of contact for this. So blurred vision, you have red eyes, also water's coming out. The ironical problem about dry eye is that you have dry eyes, but a lot of tears. You have experienced a lot of tears. So tears are symptoms of dry eye. So when you have this, please come around the eye clinic.
Now, very well then, let us look at the other part of the question that I asked. How can public health campaigns be more effective in educating the population on the early warning signs of major eye conditions?
So the first is increasing the employment of optometrists in primary eye centers. So when you have primary eye optometrists first at the grassroots level, you have people coming, not going to just the pharmacy to check, just buy maybe any eye drops, but also coming to see the professionals that will attend to your concerns. So having increased employment of optometrists, then advocacy for eye care. Like now that today that is World Eye Day, you have to increase the awareness of ocular diseases, education, ocular promotions. You have a lot of eye clinics running free eye checks today. So the first step is to visit an eye clinic and also increase advocacy for ocular problems, visit your optometrist, and also increase policies that support ocular plans and policies.
Now let us look at digital strain now. You would agree with me that a lot of people use their screens, devices, laptops, and other screens. How can people protect their eyes from digital strain caused by these screens?
So the first thing, like you're wearing a blue coat, it's always advisable that when you wear glasses that have AR coating or blue coat coating, it helps reduce strains gotten from emitting digital devices like your laptops, your computers, and your smartphones, because you tend to always be on this daily because it's part of our life, daily activities. It helps us to work and everything. But wearing this kind of glasses help reduce strains and also reduce digital eye syndromes.
Now, are there any dietary recommendations that you'd suggest for maintaining good eye health?
Yes, you can implement or incorporate food that are high in vitamins, leafy vegetables, spinach, eggs, vitamin C that are good. Or also try using eye supplements, incorporating them and use them daily because they provide nutrients for the back of the eye, which is important for you to see. That's the retina. Funny enough, they're very affordable. They have different varieties, but you always have to look at the content and look at the ones that are based on the recent study, which is the REACH2 study. There are a lot of in pharmacies nearby, and the optometrists always prescribe eye supplements.
So what advancements in eye care health have you seen recently?
The ones I really like recent is refractive surgery. You have people dropping eye. So I advise my very high myopic patients with -20, -13. If you have the money, you can opt for refractive surgery, whereby you drop your glasses permanently and you do well without your glasses. You have laser, you have better laser techniques for cataract and glaucoma management.
Doctor, earlier you talked about how we need to, in our policy implementation, ensure that we have optometrists and ophthalmologists readily available in our primary healthcare centers. And now this brings me to the next line of question, where I'd like to know, how accessible would you say eye care services in rural areas in Nigeria are?
So that's the thing. It's not so accessible, and that's why if most primary centers in rural areas do not have optometrists. So if you're on the federal level, on the state level, if you employ more optometrists, you have them closer to the grassroots. You have people now seeking increased job opportunities for the optometrists, and they will be closer, because when you employ them at your, like now, you employ them at the state level, the local government level, they are going to be operating in that local government. So each primary health centers are located in local government. So when there are increased employment for optometrists at local level, they are closer to the people. So you just have to key into any plans, go to the nearest NHIA office, register your family members, and eye care is covered by NHIS and is effective, and it covers your family and three members of your family members.
So on the final note, before we let you go, I'd like to hear from you. What advice would you give to parents regarding their children's eye health?
So funny enough, the theme for this year's World Eye Day is Love Your Eyes, and I will talk about the 4 P's to love your eyes: prevent, protect, and prioritize your eye health. So when you want to prevent any eye diseases, you want to make sure you take proactive steps to prevent by wearing your blue cut lenses to reduce harmful radiation from your computer. Also, scheduling your routine eye checks. This is a way to prevent any further eye damage you might have or tendencies, especially if you are at risk. Then you have to protect sunglasses. The weather is so hot right now, so you want to go under the sun. You want to wear the bigger the sunglasses, the better, and it provides higher protection. So you also have prioritize. This World Eye Day, I'm begging you to prioritize your eye health by booking your eye appointment with your optometrist.
So let us get your final message for this particular day.
So if you have any eye condition today, I think in all my ending closure for all my questions, it ends with visit your eye doctor. So today it's a reminder for you to visit us, the nearest eye clinic. We're offering free eye screening today. That is World Eye Day, and it will be a good day for you to book and detect any underlying eye care diseases you have. Thank you.
And now in conclusion, thank you so much, Doctor, for your time and insights on the program. There we had Dr. Mmaduagwu. Thank you so much for your time. Now in conclusion, World Sight Week is an opportunity to reflect on how we can improve our approach to eye health, both individually and as a society. In Nigeria, where preventable blindness and vision impairment still persist, raising awareness about eye care and correcting misconceptions is a crucial step towards ensuring that more people maintain good vision throughout their lives. And that concludes this week's episode of the program, Healthy Living on Trust TV. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I'm Aisha Salihu. Thank you so much for your time. We'll be leaving you with some of the facts on eye care.